So radiation is very useful for diagnostic techniques in medicine. These techniques usually involve a radio tracer. So it's a little bit like putting a transponder on, a bear in the wild, and then you can track them and see where they went and what they did, right? So here what they do is they take a radioactive nuclide and put it onto a compound, could be something like glucose, that will move around in your body, and then they can track the movement of the compound or that mixture. So the tracers, these radio tracers, are really useful because they can be detected with great sensitivity, so you only need a little teeny bit, and they behave identically chemically. So if you have glucose that has a radio tracer on it, your body is going to interact with it exactly the same as glucose without a radio tracer. So your thyroid naturally concentrates iodine. So you can study the thyroid and look for thyroid cancer by giving a patient iodine 131, which is radioactive, and that will accumulate in the thyroid. That radioactive iodine emits radiation, which can be detected with great sensitivity. And so you can look at the rate of iodine uptake, you can image the thyroid gland, all without anything invasive like surgery. Different elements are taken up preferentially by different organs and tissues. And so different radio tracers are useful in imaging different sorts of things. Here's that iodine. It's very useful for the thyroid. Phosphorus 32 is concentrated in tumors, and so that can be used to study tumors. These half-lives are all on the range of hours to days. Remember, each half-life, the amount of that substance is cut in half. So it's going to take several half-lives before it gets down to a super low level. So this is a figure that shows a bone scan created by gamma ray emissions of TC99M. Another one that's used for this is P32. But cancerous tumors naturally concentrate phosphorus and TC99M. And so you can see where the phosphorus has gone and identify where the tumors may be. So this is nuclear medicine. You may have heard of PET scans. PET stands for positron emission tomography. This is very cool. So use a positron-emitting nuclide like F18, fluorine 18. You attach that to some metabolically active substance like glucose, and the glucose travels through the heart and the brain all over the place. As the F18 decays, it gives off a positron. When the positron combines with an electron nearby, particle and antiparticle, they annihilate each other, and when they do that, they shoot out two gamma rays in opposite directions. So this is very, very cool. So then you can give a patient fluorine 18, and then you can scan their brain, and you can locate where these antiparticle collisions are happening by looking at the gamma rays that are given off. It's really, really neat stuff. So radiation is useful in diagnosing diseases. It's also useful in treating disease, especially cancer, because it's especially effective at killing rapidly dividing cells. So one method is using gamma rays focused on internal tumors. A lot of times you have a cancerous tumor, they'll do surgery and physically remove it. Well, that's great if you can do that, but if it's in the middle of your brain, you may not be able to do that without causing severe damage to the patient. So what do you do with these inoperable tumors? Well, you can get them with radiation. So the gamma rays are focused on the internal tumors, but the beam is moved around 360 degrees, so it's coming at the tumor from all different directions, not all at once, but it's moving around. Because when the gamma rays go through healthy tissue, it damages the healthy tissue also. But by moving it and doing it from all different directions, focused on the tumor gets hit by all the gamma rays, right? Whereas healthy tissue experiences very few gamma rays going through it. And so the healthy tissue only gets a little bit of radiation, and then the tumor gets a lot of it. As I mentioned with my friend, patients do often develop symptoms of radiation sickness because of this. But the dose is controlled, and this is a dose that they can recover from. Now, does this increase the risk of future cancer? Yeah, it does. A therapeutic dose of 100 REMS increases cancer risk by 1%. Like, well, that's not good. You're treating my cancer and you're going to give me more cancer. Well, a 1% increased risk of cancer is very acceptable if you have a 100% chance of dying from the cancer you currently have, right? It's like, okay, well, no radiation, you die. Take the radiation, you're going to live, but you might get another cancer in the future. I know what I would choose, right? There is risk-benefit analysis in like everything that we do, and we don't even realize it. So this is one of the things that I found interesting and very disturbing during COVID-19. There was this huge range of reactions. Some people were like totally freaked out and just didn't want to go anywhere, do anything, because they were just so afraid of this risk. And then other people were just like totally, this isn't even a thing, and they're both wrong. But you think about like the risk of influenza. Influenza kills people every year. Do we go around freaking out about the flu? No, we don't. So COVID-19 is killing people too. Should we freak out about it? I don't think so. Should we take it seriously? Absolutely. I mean, one of the biggest problems was we had no idea what it was doing or what it would do in the future, right? And then just overwhelming the medical system was predicted to be a huge issue, and it was a huge issue. Then you think about, just how many of you rode in a vehicle to school today? Bus, car, most of us, right? That's very risky. You go look at the statistics, and people are killed in car accidents and stuff all the time. Of course, people are also killed by stray cars on the sidewalk, right? You can get hit by a bus crossing the street. You can die of an aneurysm in your sleep, right? You go to bed, everything's fine, and you just never wake up. How do you protect against that? Well, you can't, right? So we accept risk all the time. We've become accustomed to it, and we don't even think about it. It's just not on the radar. So now I've made you think about it, and hopefully nobody will get like super paranoid and freaked out. If you do, I'm sorry. But there's risk in everything. And I think that's, one of the things that having an understanding of science can help you understand. Any questions? Other applications. Radioactivity is often used to kill microorganisms. So implantable medical devices, like a pacemaker. You're going to implant this in someone's chest. It needs to be sterile. You don't want to be introducing any bacteria or viruses when you implant this device. How do you sterilize it? Well, I forgot the name now. When you heat it. Like dental instruments and surgical instruments are heated in a special thing that has a special name. Nobody? Dang it, can't remember the name of it. It'll come to me after. Anyway, you can't do that to everything, right? Because these devices have batteries in them, and they just can't withstand that heat. So how do you sterilize them? Radiation is one way that you can sterilize them. Radiation can be used to kill bacteria and parasites in food. It can kill E. coli, kill salmonella. We hear, seems like almost every day, this thing got recalled, that thing got recalled because of salmonella or E. coli outbreak, because the food is contaminated, right? And these things kill people. Well, if we irradiate the food, we could eliminate this. You can kill all the salmonella, you can kill all the E. coli in the food. But people fight against this because it's not natural. You're going to put radiation in my food? Oh, horrors, right? Well, it doesn't make the food radioactive. Your food's not going to glow in the dark, right? It doesn't even change its nutritional value. It doesn't change anything about the fruit itself. It just kills the creepy crawlies that are growing on it. This is a picture of strawberries. These were picked at the same time. These were treated with radiation. These were not. And then they were stored the same way. Which ones do you want to eat? I prefer to eat the irradiated ones. There are no health effects of this. None. But people are scared. So they're willing to put up with E. coli and salmonella and rotten strawberries. And I don't get it. And the other really funny thing is that pork is irradiated. All pork in the United States is irradiated because of the threat of trichinosis, which can cause lockjaw and death. And people don't freak out about that because they just aren't really aware of it. So, yeah, humans don't always make much sense. Radioactivity can also be used to control populations of harmful insects. One strategy is to take a bunch of fruit flies and sterilize them with radiation. Not killing them, but just making it so they can't reproduce. And then you release those into a field, and all these sterile fruit flies are going out there and mating with all the unsuspecting other fruit flies and producing no offspring, right? And so you can knock the population down using radioactivity. So lots of really cool uses for radioactivity. Yeah?
Google says
Autoclave, thank you. Yes, the autoclave. Put your instruments in the autoclave, and it heats them to a high temperature, and I believe there's steam involved as well. Kills things. But, it can damage things as well. Not everything can be autoclaved. Thank you for that.